A very good morning. It is now 7 o'clock local time on this 14th day of July 2020. My name is Michael Gitonga. The show is Morning Express and we welcome you aboard where we're going to be looking at what's making headlines on the dailies right here. We'll also be giving you stories that are making headlines on the international and local plane. I am not alone. Trix, good morning.
Good morning to you and those who are watching us from home or wherever you are. This morning we shall be taking a look also at the revenue allocation formula that has caused a bit of tension in the Senate. They met yesterday but adjourned. There's expectation that there shall be a decision that shall be made to ensure that this is streamlined, because as things are, the report that is on the table indicates that there shall be winners and losers, and we shall have Isaac Mwaura, the senator, as well as Irungu Kangata, giving us an overview of why this is happening and what this bodes for the future of counties as far as revenue allocation is concerned, and which financial years we are talking about as we look at what period the counties shall be affected by this. So this and more, stay tuned on Morning Express. And remember, you can be a part of the conversation by getting on Twitter and telling us what you think, contributing, asking questions, and of course giving us an answer to the question that we are asking you this morning.
And the question this morning is, do you think the marginalized counties are justified in opposing the new revenue sharing formula? Do you think that the marginalized counties are justified in opposing the new revenue sharing formula? Remember, this has been a bone of contention for counties for a while now. Since 2015, there was meant to be a revision of the revenue allocation, and some counties feel they have been marginalized not just by many other things other than the financial aspect of it. So the revenue allocation, of course, becoming a major bone of contention. And as mentioned, that's going to be a subject that we're going to be delving into a little bit later on. But for now, we start with looking at what's making headlines on the dailies. And as usual, we start with the Standard, where the headlines is how to fix schools crisis. Now, we do know that COVID-19 has definitely made things change in many sectors, one of the biggest hit being this education sector. And of course, we do know that the CS for Education did announce not too long ago that there's going to be a moving of the examinations, KCSE and KCPE, and as a result, we're going to have a whole repeat for the whole stream of students, both in secondary and primary school. So experts have come out to weigh in and, well, give their comments and feel that the government took a very lazy option in going that way. And they've given a number of options right here on the front page of the Standard of other ways that maybe the government would have handled this.
Absolutely, and some of those include the recalling Form 4 and Standard 8 candidates in September to prepare and sit national exams. And then we have use a capitation fund to equip children with tablets so that they can keep up with their ongoing education. And we remember yesterday the headlines, or rather the papers, were washed with the suggestion that holiday tuition, or rather just tuition right now, should go on, something that had been banned in the past. Another one is allow learners to transition to the next class, and of course just find ways of keeping up with education and making sure they get what they need from the previous year and the current year, whatever class they would have been classified in. Change the academic calendar is another option. I think that's quite radical. And then home tuition, as I said earlier on, that was a suggestion given by the CS, given that the situation right now would call for some form of education to go on, and not every parent can actually be a part of that. Not every parent is equipped with the knowledge or even the time to ensure that they keep the students learning at home, and therefore tuition would be a good option, I would imagine. We're having this being quite a spread on this paper from page 2 all the way to page 5, and we're being told on page 4, declaring 2020 a lost year was a mistake. This is according to one of the experts, Edward Katue Nzinga, and he feels that this was not the way to go. And I mean, you can take a look at that article and find out why he feels that was a mistake and ways in which the education calendar can be kept up with, at the same time ensuring that, you know, we keep in line with the concern that is brought around by COVID-19.
Absolutely, and of course it's very deflating for the students and parents to imagine that a whole year is, to use the CS's words, lost. And again, this of course puts into perspective the question of what really is education. Why would we lose a whole year? But again, there's also the lack of preparedness on the part of the schools in terms of going IT. And of course, we do know that the Kenya Institute of Curriculum Development had already released, a revised circular and curriculum which students can use online. But again, one of the other things that is brought into light is the inequality of education in this country, given that there are those, even if we had online classes, there are those who would be able to access them just by virtue of accessibility of electricity and the likes of internet, and those who do not have. So that, of course, is a debate that continues. According to one Benson Njoroge, he says that we should take calculated risks as a country and let candidates back into class. One of the suggestions that had been given in ensuring that we do not, quote unquote, lose the year is for students to be given their marks based on what their results were previously, what we'd call continuous assessment. But that, of course, is still a debate that is out there. But if we're to go with what the Education Ministry has given out so far, it is going to be a lost year, or let's just say that all students are going to be repeating, which of course again is very disheartening, given that they were all preparing to be ready for those exams. But of course, another issue that is quite well covered in the dailies this morning is the fight against COVID-19. On page 6, COVID-19 effects could be worse than first thought, according to experts. I remember reading an article that was posted by Richard Quest, who is a well-known business anchor for CNN, and he was basically diagnosed with COVID-19 and was positive, and was talking about the effects after. He has now recovered, but still has many effects. But this article also highlights some of those effects.
To home on the Daily Nation, the front page actually this morning, we're being told about COVID lives and stories of the ones we have lost. Now, they actually go ahead and introduce this particular element of the suffering that is meant by COVID-19 or meted by COVID-19 onto our population by posting the pictures of the young people, young professionals, and who have lost their lives due to COVID-19. And we are having the one and only Dr. Doreen Adisa Lugaliki, who has been trending online because she lost her life because she was in her line of duty. She was a gynecologist, quite young in the prime of her career, and there's so many faces right here on the front page of the Daily Nation that will give you an overview of what it means. And they actually say, if you're one of the people who says, who needs to know, who ask, do you know anyone who knows anyone who has suffered COVID-19 and lost their lives, then take a look at these faces. These are the faces of people who have lost their lives due to this virus. And it's quite tragic when you go through their careers, their lives, and even just the pictures actually bring quite a chill, because these are young people, and there is that assumption that the young do not actually get affected adversely, but clearly this article and this front page headline begs to differ on that front. For this is also another spread that Standard chose to go with the education story, quite the spread, and the Daily Nation this morning is choosing to go with COVID-19, and it is moving all the way from page 5 down to page 9, keeping you updated on COVID-19, the struggle that Kenya is going through right now.
Yes, so giving us reasons to ensure that we stay safe, especially for those who may have felt that even if I got COVID-19, I am young enough to recover, and as a result, I'll be okay. Page 7 does give us another reason as to why, page 7 of the Standard, as to why we must make sure that we stay safe and avoid as much as we can to be infected. And recovered COVID-19 patients may lose their immunity. And this again is really piggybacking on the previous article that says that the effects may be worse, and they may be worse not just as you are, COVID-19 positive, but even after. And as a result, they say that research is now showing and suggests that immunity may not last more than a few months, as is true with other influenzas or other diseases of that nature. So you may be infected and recover, but that doesn't mean that you cannot be reinfected again. So
right.
that, of course, is something and a warning that many of us should take heed to.
Absolutely. And in nations such as Japan, it has been studied that people who have actually recovered have a second bout of COVID-19 and taste positive again. So even after people get, to be treated and let out of the hospital after suffering this deadly disease, they actually still have to keep up with those measures, as Michael has said.
Absolutely. And we are now joined by Senator Isaac Mwaura, I believe, via video link. And good morning, Senator. Thank you for joining us this morning. We are currently going through what's making headlines in the dailies, and we've pretty much looked at what we have this morning on the Standard. And on the Standard, we have how to fix schools crisis. And this, of course, is as a result of the pandemic that we are all going through and learning together. But unfortunately, it looks like the students and the learners are taking a huge hit by virtue of the fact that exams have been cancelled for this year. And as a result, there is a repeat of the whole stream. So maybe just to get your thoughts on this, Senator, as to whether this was the best decision that the Ministry of Education would have done. And of course, the question here is not whether children should be reporting to school or not. I think that is not in contention. But are there other creative ways that would have possibly handled this to ensure that our learners still continue with their education?
Thank you very much, Mike, and I want to greet all the viewers of KTN where they are, KTN News. I think first and foremost is to say that all of us, and especially those of us who are parents or guardians, people who take care of children, there has been a concerted fear amongst us about what will happen to our little children. And parents really love their kids. And you are not going to see any protestation out of this decision, because you would rather that children repeat a class because they had only done up to March of this year than they go to fail. Because if we continued with this, it would have been cheating. You cannot administer exams online, and also the reach of the internet is difficult, and the facilities amongst across the country in terms of schools. I mean, many schools are in deplorable conditions. So it's only fair that we give our children a fair chance. And of course, we used to lose 1 year, a whole year, waiting from Form 4 to university, if you can remember, Mike, during our days, because you would stay up nearly 2 years outside. So, well, it has been done before. It is not the best. That was, that gap was breached, when there was a double intake. I believe that can also be corrected, in future using many other ways. But because we have an exam-based education system where you value people or you rank people based on how much they scored, then this is what you end up with. But if you have outcome-based education that is not primarily, through assessment, then you could have said, well, people can continue doing their talent, they can continue doing their art, they can continue doing their, mechanics away from examination as such. But because that is not the case, then it becomes a challenge. And Mike, we are coming from a situation where there have been mass hysteria in schools. Just recently you had the stampede in Kakamega, where a lot of kids actually, were killed in that stampede. And now when you talk about COVID-19, that we have even seen a 1-month-old baby has been affected by COVID. We've seen children die because of COVID. And, some of the children could be having pre-existing conditions that are chronic. So really, it's not good. And also remember, these little children are also the ones who go back to interact with the over 58-year-olds, their parents, their grandparents, you see, the people they live with. And so it then therefore becomes very serious, to contaminate actually or to spread the virus. Older persons, the people in colleges, they can wear masks. You can see the economy has been opened up now. And we, the older persons, can actually take care of ourselves. But Mike, when you leave it to little children, who I'm finding in the estates around with no masks, nothing, they're just playing with each other. God is great, actually.
All right, and Senator, this, of course, would be an opportunity for us as a country to really introspect and ask ourselves some questions, because COVID-19 is here to stay. And as a result, Well, postponing the year is what we'd have to do now, but we really have to come up with creative ways of ensuring that the education of our children continues. And not just that, the inequality of our education system. The reason why we cannot have the exams is because there are some children in rural areas who are not able to access, online classes. So as a result, it would be unfair to still go ahead with the exams. But what do we need to do moving forward? Because, like I say, COVID-19 should be a lesson for us.
Yeah, thank you very much, Mike. I think first and foremost is to say that, interestingly, Kenya has got one of the best internet, but then do they have the gadgets? If, for example, we had implemented the laptop project, then it would have been easier to say, yeah, actually every child at the primary level, they have some, some kind of gadget that then they can be used for them to be reached out to. But that's not the case. It's only now that I think I saw Google Loans that also could be taking internet to far-flung, counties. And most of the internet-based connectivity is coming through the mobile phone. Some places they may not be as reliable. But also further to that, I am not very sure whether our school systems has been able to adapt to COVID-19 measures. For example, how do you practice social distancing within a school where people have to come and parade? When you have a class of 80 students or even more.
And Senator, sorry to interrupt you. Sorry to interrupt you. I think that the main thing is not so much returning to school, because that's not in contention. We cannot do that right now. We'll be putting our children at risk. But what do we need to do, especially moving forward, to ensure that when there are these kind of disruptions, do we have our children, for instance, with tablets? Can we ensure that we have classrooms, virtual classrooms that can be ready for our students? Can we ensure that our teachers are equipped and ready to maybe have, like Nyumba Kumi kind of setups where they still continue with learning without necessarily going back to school as we knew it?
Yeah, thank you very much, Mike. I think there's a huge shortage of teachers. And the last time I checked, the Kenya National Union of Teachers was estimating that we have a shortage of about 90,000 teachers in primary school section and a lesser number in secondary school sections. We have over 23,000 primary schools, you see. And also in terms of the infrastructure, you see, we did not succeed in having the laptops. And also, this is the new normal. You remember now, because of COVID-19, is now that we are also realizing, like, I don't have to come to KTN News Studio for you to have an interview with me, and vice versa. And also, we in Parliament, for example, are having virtual meetings, like I have one for the Committee on Devolution later on today. So we are adapting to the new normal. And I think now, between now and January next, or 2021, then we will have made those adjustments so that also they can also be factored in the budget. They can be put in supplementary. So it's a new endeavor. And the challenge has always been that this is a Western kind of based, intervention. We cannot do it in Africa, but we've actually proved that we can do it. So I think it gives us an opportunity to adjust and also to know how teachers can be trained to administer virtual learning, because most of them are used to the brick and mortar kind of learning with blackboard and a chalk. So really, that is something that we need to do going forward. But certainly, one thing that, Mike, I need to reemphasize is the exam-based kind of education system that then would not even allow us to administer exams online, because people would be cheating, they would be copying and whatever. Maybe it also, it's a shot in the arm for the outcome-based CBE, education, so that people can be looking for skills which are more relevant than just rote learning, because Mike, and this is very interesting to say, that school rewards memory, but life rewards imagination. So you can see it very clear that if you want to have a good life here, you have to imagine. And for example, virtual learning is a lot of creativity, is a lot of imagination. Correct. So I think that is the way we need to go going forward.
All right, and let's look at other stories that are also making headlines. And of course, as imagined, we have a lot of coverage on COVID-19 on page 6, 7, and 8 of the Standard this morning. That's pretty much, actually even 9, it's pretty much to do with COVID-19. But maybe from your position as senator, one who is in leadership in this country, what are some of the things we need to put in place to ensure that our health system and our health sector is revamped and equalized as well? Just like the education system, we are seeing a lot of inequality when it comes to the health sector right now, particularly when we look at counties. We do know that part of the discussion you're going to be having later is on revenue allocation, but when we look at even our hospitals and our level 4 and 5 hospitals, we have a huge discrepancy between counties and their level of preparedness for COVID-19. Your thoughts on what needs to be done?
I think our health system is meant for the rich. And by the way, it's good to say that, unequivocally. This system is meant to benefit the doctors, the medics, and people who make a lot of money. And because we have allowed our doctors, who also are paid by the taxpayer, to run their own clinics, then they have no motivation. I mean, I have had serious cases of poor services at level 5 in Kiambu County. You have had stories of people sharing beds. Because then what is the motivation anyway? It's only that this crisis has come, and you can see people say we have 463 isolation beds. But when we started this, Mike, we had slightly more, actually it was 115 ICU beds in the whole country against a population of 47.5 million. And the same thing you are seeing also in America, where Obamacare has been thrown out of the window because they don't want to be a socialist country. And you can see how pathetic it has been. It's only countries like, for example, like the UK, because of having a universal healthcare program called the National Health Service, that you've seen actually they've been able to somehow contain the situation. And so we are really being tested, to ask ourselves this question. How much money are counties allocating to hospitals? How many health workers are there, for example? What are the facilities? What is the effect of the medical leasing equipment, you see, which we have been auditing in the Senate? How prepared our medics, for example. You have seen, even I think the advertisement closed yesterday, the Nairobi Metropolitan Service has advised for a 3-month contract for the medical officers and other people in the profession. So really, we are not really prepared. I think because the middle class, the burgeoning middle class, is able to pay for itself in private healthcare, then that's where the problem is. And by then, Mike, you'll be surprised to realize that out of the 38 billion that NHIF collects in this country, 22 billion goes to private hospitals. It's another form of corruption because
that is deplorable.
Exactly. And the only money that goes to public hospitals is about 8 billion. So you can imagine. So where is this other money going to? And who is this that is being paid by NHIF? You remember there was a case of Nairobi, Women's Hospital. So we have also to break this cartel-like kind of behavior. I was very shocked, for example, to see a doctor, who was taking care of me being paid 52,000 for seeing me for some few minutes, and a nurse who was with me throughout being paid 900 shillings. I mean, really. So there are a lot of disparities,
Absolutely.
And we need to seriously reform the health system. But also, having said that, I must also commend, I must really, really commend our healthcare workers. Because as you have seen, the beautiful young lady who is trending, in the internet, because she just succumbed to COVID-19. And there are many others, yes, unsung heroes and sheroes who have died because of COVID-19. And we must really congratulate all of the, frontline healthcare workers, and they need to be taken care of. I think also, sometimes, necessity is a matter of invention. So hospitals across the counties must now take this opportunity to redirect their budgets and efforts actually to improve upon the healthcare system of Kenyans.
Absolutely.
And also something very interesting that has also come out, Mike, is good, I say, that the morbidity rate has gone down because people are washing hands. So I think we need to have wash programs across the country so that people can maintain high levels of hygiene. Just yesterday, I attended a very successful launch of the Kazi Mtaani program in Githurai, bringing together over 1,400 young people to help in the hygiene and sanitization. Because all of a sudden, we are realizing that is what is creating all this health crisis. In fact, if you go to Rwanda, and I have participated with some ministers sometime in 2018, there's Uganda every Saturday. Every first Saturday of the month, they go out there to clean up their cities, to clean up their homes. And you can see Rwanda is one of the cleanest, you see, and we've not had, crisis coming up. So it is actually an opportunity to see how is it that we can do it. In fact, you've seen the Rwandese military, building more hospitals, you see. So yes, it's a crisis, but it's a silver lining. How do we make sure that after COVID-19, we reduce the rate of infections and diseases, but also we improve our healthcare system.
And of course, one other dragon that we still have not managed to slay is that dragon of corruption. Your comments on some of the funding that has come through, because there has been narratives that, you know, money has come through specifically for COVID-19, but we still have counties that are not prepared. They don't have the minimum required 300 beds, which is, again, totally unacceptable given that that money has come through, and yet we are still not getting ourselves ready. And with the opening up of travel restrictions, we are likely to see a spike both in the urban centers and even in the rural areas.
I think that is a lack of imagination for any governor who steals money from his own people or her own people just to come and build flats and to buy properties in Nairobi. Then what was the need of devolution? Because money was supposed to go and spur economic development. We are hearing stories of a governor from northern Kenya, who was intercepted with 100 million in an ambulance. You see, those kind of stories are there. And others were intercepted with 70 million at a roadblock somewhere. I mean, those kind of stories are the ones that, make a mockery of devolution. And I've said time and again that devolution is revolution. And I think, people are actually becoming retrogressive on our progression when they actually steal money from counties that are most deserving, from populations that are fairly ignorant about their rights, people who have been left behind just because they want to accumulate